Health Department says changes on the state level could impact the thousands of people they serve.
In June, the state teamed up with a vendor. They studied how programs like WIC and family planning were being delivered.
The county's health director worries his community is being left out of some parts of the process. KETV Newswatch 7's Quinicia Fraser investigates.
For many families, visiting the doctor's office to vaccinate children is just another thing to check off on their back-to-school to-do list.
For me, that I have a big family, it would be very complicated.
Blanca Moreno is a mother of 10. In the past, she struggled to find a place with affordable shots for her little ones.
It was very hard because my kids didn't have Medicaid at first. And then I had to look for a place to vaccinate them where the price was low, and then I applied here.
But at this Pottawatomie County Health Department clinic, Moreno can get her kids vaccinated for free. The director of the health department says they run other programs in about 7 other counties.
So we set ourselves up to be the regional hub of Southwest Iowa. It comes along with part of being the population base of Southwest Iowa. It would only make sense that you would run your services out of our county.
In June, Iowa's Health and Human Services announced it would work with a vendor to study the delivery of their programs. According to the state, by July 1st, Public Health and HHS combined into one department.
Our main concerns right now is just the communication.
In a June press release, Iowa HHS said a vendor, Health Management Associates, will study why current systems are structured the way they are and the historical context of those decisions. Iowa HHS said, quote, the study will also examine existing operational capabilities and gaps and the funding and resource models that drive the current system, end quote.
We know that there's a vision and a goal out there. We know that they have an idea of what they foresee the future to be like. We would just like them to include us in on those conversations. Let us know what to expect coming down in the future.
Iowa HHS held a series of town halls throughout July and August regarding their system alignment assessment.
In the town hall meeting, and they talked about the interview process that was going to happen. That was one of the big arguments and contention points that came up, was that only a few of the health departments were selected for the interview process.
Wyant says that interview process allowed for some health departments to give their input on how they run certain programs like WIC and environmental health.
Has Pottawatomie County been selected for any interviews?
We have not been selected for any interviews on any of the different programs that we offered, and there's 9 different programs out of their list that we offer.
In an email, Iowa HHS tells KETV, quote, HMA conducted stakeholder interviews with some local public health administrators and representation from the different types of public health agencies and different county sizes was considered when selecting which agencies to interview.
They need to really be boots on the ground if they want to capture how our agencies work with one another, or at least come individually interview us and hear from us.
Wyant says the health department also still has unanswered questions when it comes to future plans.
Do we plan for more funding? Do we plan for less funding? What does that look like for us in the future?
For the health department, these are questions they want answers to, especially with families like Moreno's depending on them. Quinicia Fraser, KETV, Newswatch 7.